Hello everyone, welcome back to ManpreetRN Talks. I hope you are all doing well and studying hard to pass your NCLEX. So in today's video, we are going to practice UWorld endocrine questions, the type that NCLEX really loves. And by the end of this video, you will know exactly how to think in the exam to crack your NCLEX. So let's start. So first one, this is the case study. So you can read. For journal health, the client had worsening lethargy and confusion over the past 2 days. This morning, the client vomited and was difficult to arouse. Client appears cachetic. So, cachetic means the severe weight loss with muscle wasting. Client receiving chemotherapy for advanced small cell lung cancer. So in integumentary mucous membranes, they are most. So in pulmonary vital signs, respiration rate that is 16, SpO2 96% on room air, breathing unlabeled, breath sound that are clear bilateral. Intermittent dry cough is present, reports of 40 pack year smoking history. In cardiovascular vital signs, temperature that is 98.6 degree Fahrenheit, pulse 98, blood pressure 145 by 95, normal heart sounds, no edema or ascites. So in genitourinary, that concentrated dark amber urine, client's spouse state that the client has urinated only once or twice daily for the past 3 days. So as you can read from the case study, so patient have some problems. So in psychosocial, patient drinks 3 glasses of wine per week. Now we are moving to the questions. So click to highlight below the four findings that require intervention immediately. So now we can read from the paragraph that is same here. So in general, the client had worsening lethargy and confusion. So that is the abnormal thing. We have to click it. And after that, over the past 2 days, this morning client had vomited and was difficult to arouse. So vomited we also select, and after that we select it is difficult to arouse. So in the starting, how to solve this? So for this we have select what is the abnormal in first. Then after that from the all we have selected, so just select only four things that is most priority to inform, that is most priority for the patient because patient cannot get sick. So in this, like we have select cathetic with muscle wasting, that is also abnormal thing. So now moving to the integumentary cystine, that is mucous membrane, they are moist. So we will not select. And pulmonary vital signs, respiration rate that is 16, no need to worry about it. SpO2 that is also in normal limit. And patients say, and the breathing that is unlabored, breath sound that is cleared and intermittent dry cough is present, but breath sound that are cleared and it reports 40 pack year smoking history. So due to smoking, there is intermittent dry cough may be present, so it's not need to worry about it. In the vital signs, patient have increased blood pressure, that is also need to worry, and normal heart sounds, no edema, no ascites, that is normal. So in the GI, genitourinary, it is very more considered. So as patient have concentrated dark color urine and client spouse state that the client has not urinated only once or twice daily for the past 3 days. मतलब urine output means it is decreased. So, next question, the nurse has reviewed the information from the laboratory result. So, the nurse suspect that client is experiencing syndrome of inappropriate in antidiuretic hormone SIADH. So, now we are going to check the laboratory result. So, now we can see in the result, lab result, the WBC that is 9,000, that is not increased, so it's normal. Serum sodium level that is 117, so it is low. Patient is having hyponatremia, severe hyponatremia, and serum osmolarity that is also within normal. And in the urinalysis, urine color that is dark amber, and WBC, that is 0 to 4 per low power field, that is 0, it is also normal, and urine osmolality, that is 1300, and it is increased, and specific gravity, that is also increased. So now moving to the questions. So which of the following findings are consistent with the SI-ADH? So select all that apply. So in SATA question, always remember one thing. So just tick that option in which you are 100% sure. So in the SATA question, there are negative marking. So just be sure, select the that option that in which you are 100% sure. So it is corrected. So in this SIADH, we can see serum specific gravity as increased because the urine that is concentrated, so serum sodium level that is also used for SIADH diagnose, mental status that is also included in this, and urine output that is also included. So next question, the nurse should recognize that the client at risk for due to. So in this we have, in this type of question we have to select the correct answer. First we'll have the risk, what is the risk for the patient risk, and after that why it is happen. So for example, in first we will see the patient have all that options, and in that last we have all three options. So now we are moving to the options like in which we have see the serum sodium that is very low. So now we can see patient is having may have seizures. So it is the more risk for seizure. So as due to hyponatremia. So just submit it. Now moving to the next question. For each potential prescription, click to specify if the prescription is anticipated or not anticipated for the care of the patient. So in this type of question, always read below line, like in the note, each row must have one response option selected. So sometime two more than one option may be selected. So always have a look below to solve this question. So in this first option, that is monitor daily weight, that is anticipated because SIADH patient, they have more prone to get weight gain due to more fluid retention. So it is corrected anticipated. Next is administered desmopressin. So in SIDH, we do not administer desmopressin. In DI patient, we have administered desmopressin. Initiate seizure precaution, that is very important as patient sodium is 117, patient is more risk for seizure. Place the client on fluid resuscitation, that is also correct because in the SIDS we prefer fluid restriction as the already patient having fluid retention inside and patient is having hyponatremia. So, and other perform frequent neurological checks, very important. So next question. So nurse is ambulating the client to the restroom when the client begins to have a tonic-clonic seizure. So as the patient sodium is low, patient is having seizure. Which of the following action should the nurse take? So next, that is also a SATA question. Select all that apply. So first is activate the rapid response team. So it is corrected or not. So then note the time when the seizure start and stops. Place the rebreather mask on the client during the seizure and sit with the client in nearby chair until the seizure ends. Suction the client after the seizure ends. So what are the correct option for these questions? So write down in the comment section. So if you like this video, kindly do subscribe my channel for more NCLEX tips and videos. And they will really help you to pass your NCLEX in first exam. So till the time I will update a next video, please do study, work hard and pass your NCLEX in first attempt.